Myth number 5 is that using a GLP is cheating. And this pisses me off so much. If you think that this is cheating, then any medication that we use out there to make ourselves healthier is considered cheating. It's not the drug itself that's causing it. It is the misuse of the drug itself.
Welcome to the Retreat Radio, where we go beyond temporary fixes and surface level symptom management. Here, we dig into the real root causes behind your symptoms so that you can understand your body, advocate for your health, and ask the right questions. I'm Heather Witt, physician assistant and owner of the Retreat Wellness and Aesthetics. This podcast sits at the intersection of aesthetics, longevity, and functional medicine, and you'll get information without the sugarcoating, the trends, or the nonsense fluff. Let's get into it.
Hello, everybody, and welcome back to the Retreat Radio. My name is Heather Witt, and I am a practicing physician assistant out here in Newport Beach, California. And today I want to talk all about GLPs. So I'm sure you guys have heard of these. They're just booming in the industry right now. I feel like everybody and their mother is on one, but I feel like they are very misunderstood, and there's a lot of misinformation out there about them. Pretty much these days, I feel like you could just go to the street corner and you can find yourself some Ozempic or another tirzepatide or anything like that. But I feel like really to be successful in a program like this, it's really important to understand how these drugs work. So I want to go over all of that today with you. I want to talk a little bit about the difference between the three types. I want to talk about when to choose which one, or when one might be better than the other. And then finally, I want to talk about the top 5 myths when it comes to GLPs. So let's jump right in. I think it's really important to first understand the difference between the GLP-1s, the GLP-2s, and then the GLP-3. So let's start with the GLP-1. So this is most commonly known as semaglutide. Brand names include Ozempic, Wegovy, and Rybelsus. This is considered a GLP-1. So this means it hits one receptor, which is the GLP-1 receptor. And the main kind of purpose of this one is that it kind of slows your appetite. It slows the rate that your stomach is emptying. And it works by basically controlling the glucagon production that you have after meals. So this one is a great one that basically just helps you eat less food. The second one, which is GLP-2s, is most commonly known as tirzepatide. Brand names include Mounjaro and Zepbound. And this does everything that the GLP-1 does, but it also hits a second receptor called the GIP. And this really helps with improving insulin sensitivity, how your body is using and processing nutrients. And it just adds that extra little layer of intensity. And it also, despite being a little bit stronger, can actually give less side effects than a semaglutide. But we're going to touch on that a little bit later when I talk about some of the myths. And then finally, we now have the GLP-3, which means it hits 3 receptors. So this one does not have any brand names because it is currently not FDA approved. It's still under study and investigation. But this is retatrutide, which is just going bonkers in the industry right now. But this does everything that tirzepatide or the GLP-2 does, but then it also adds that glucagon receptor. So glucagon is a hormone that typically raises your blood sugar. However, what we're seeing with retatrutide is that when it's paired alongside the GLP-1 and the GIP receptor, you actually get an increase in energy expenditure. So not only is it helping you to eat fewer calories because it's controlling your appetite, but it's also helping your body to burn more energy. And this is, I think, why it's gaining such popularity and why a lot of people are using it already despite it not FDA approved yet, is because it's adding that extra component, which is allowing people to lose a lot more weight. But again, we're going to touch on this later, why there are some caveats to that. So just to recap really quickly, we have the GLP-1s like semaglutide, which help you to eat less. We have the GLP-2s, tirzepatide, which do the same thing, but then they also help you to boost your metabolism and process nutrients. And then we have retatrutide or the GLP-3, which again does all those same things, but then also helps increase your actual energy expenditure. So that's kind of the main difference between the three. And then I want to jump a little bit into how we use these at our practice and how I kind of decide which one I want to choose for a patient. And then we'll jump into the myths. So right away, we can just cut out retatrutide. So we do not use retatrutide at our practice because it is not yet FDA approved. So anybody out there who is using retatrutide is using a research grade peptide. And here at the retreat, we do not use any research grade peptides. I go into a lot more detail on peptides and where we source them from and where you should be getting your peptides from in an earlier episode. So I don't want to go into too much detail on that here, but basically we do not use any research grade peptides or physician dispensed peptides here at our office. We only use fully compounded pharmaceutical grade peptides here. So I will make sure that I link that episode down below for you guys just so you can find it a lot easier. But so we don't use any of that one. However, I am excited for it to be FDA approved so that we can use it in certain capacities. I also want to look at more of the data of what it is showing before we kind of build that into our programs. But to me, I think that more does not always equal better. So how I envision us using retatrutide in the future is for patients who have a lot more weight to use, or possibly patients who have plateaued on other medications. Because one thing that we are seeing in early preliminary studies is that it is really, really strong. And all the community hears is that it has a higher percentage of weight loss. So people think, oh, well, that's the one I want because I want to lose the most weight. But say take someone like me, I do not have a lot of weight to lose. I do not need something potent like retatrutide unless I am specifically trying to target something with that glucagon receptor. So I think it's going to have its place, but I definitely think already, even before it's FDA approved, it is being misused. So how we generally go about using semaglutide and tirzepatide here in our practice is most patients, I start out on a semaglutide. Number one, it is way more affordable than a tirzepatide. And number two, most people just don't need something stronger. And if you are doing your weight loss programs correctly, your patient shouldn't be having side effects. So a big reason why a lot of people jump straight to tirzepatide is they think, I don't want to be nauseous. I don't want to get a small bowel obstruction. So I'm going to go straight to the tirzepatide and pay all this extra money. However, if you are dosing this correctly, like here at our practice, we have not seen very many issues with side effects. So a time where I might jump to a tirzepatide mainly would be number one, as we start getting into higher doses, if a patient needs that, sometimes we can start seeing some of those side effects emerge, usually a little bit of mild nausea. And so at that point, we can switch to tirzepatide and patients do a little bit better with that. The second most common reason that we might switch or start with the tirzepatide is if I'm specifically trying to target insulin sensitivity. Again, I have another previous episode that we recorded called The 5 Most Common Labs Your Provider is Missing. And I go into a lot more detail on the insulin sensitivity. So I don't want to spend too much on that time on that here. But again, just look below and I will link that episode so you guys can check that out as well. So if I see someone with a really high insulin level, it's showing me that they have some insulin resistance, and this could be something that down the road could lead to diabetes. So in somebody like that, typically tirzepatide does a little bit better on reducing that insulin load so that we can get to a better metabolic control. So those would be kind of the two main reasons that I would actually switch to a tirzepatide. Otherwise, what we have seen in our practice is semaglutide works just fine. Okay, so now let's jump into, I think, the part that you guys are probably most excited about and why you're really here is the 5 biggest myths with GLP use. And this is whether you're using a GLP 1, 2, or 3. But I think that it's all over the board with this. I feel like, as I said earlier, everyone and their mother, I feel like, is using this these days. But it either gets a bad rap because it's being misused, or people think you're cheating, or, there's a lot of misinformation out there on GLPs. And so I want to go through a couple different things just to kind of help everyone understand that these things can be amazing if they are done correctly. I just saw right before I recorded this, a friend of mine sent a link to the Today Show. And there's some woman was on there talking about how she was going through this like online place where she got this like peptide. And they even said in the episode, they said a compound, these compounded peptides are doing these bad things. And I'm like, I looked at the company that she used and I'm like, that's research grade. So the first confusion there is, again, the different types of sourcing. So again, go back and watch that previous episode on peptides so you guys can understand the difference between research grade and compound grade. But basically they go into this detail on how it was a click of a button. She didn't meet with anybody. There was no labs done. And she was just sent this like product in the mail. And then she was just told to take this amount of units. And then she ended up in the hospital. And the way that they were kind of presenting this episode, it was making it basically anybody who is not in the medical community watching this would just think, oh my gosh, see, this semaglutide, it's so bad. Like, this is why I don't want to take it. Like, look at what happened to this woman. It was almost as if they were like bashing the semaglutide when really it was a problem with how this was being dispensed and how this patient was being followed. And when I did the math on her dose, she was given max dose right off the bat. So this is going to be in one of the myths that we talk about, but this is just an example of what I'm seeing in the news and what I'm seeing out in the world on the misinformation. And again, how marketing can skew how you think of a product. So let's jump into the first myth right away. So the first myth is that GLPs make you lose muscle. And although this is something that I discuss every day with my patients when I put them on a GLP, it's not the medication itself that is actually wasting muscle. It is the problem of when you go on a medication like a GLP-1, what happens? Your appetite gets decreased. And if you are not making lifestyle changes, people go about their normal eating habits. They're just eating less. So the biggest thing we see is not enough protein intake and that people are losing weight too quickly. And when you have a combination of one or both of these things, that is when a medication like this is not going to discriminate against fat or muscle. It's just going to burn whatever it can. And this is where we see a lot of that muscle wasting. And the problem with this is that that is not a healthy way to lose weight. And losing muscle mass actually decreases your ability to burn more fat in the future. And it also has detrimental effects on your bone health. So this is something that we definitely want to avoid. But I think where the confusion is that, again, it's not the drug itself causing it. It's that people are using this as a magic pill and they're not making lifestyle changes to go along with it. All right, myth number 2 is that you have to stay on these forever if you want to keep the weight off. And that is absolutely untrue. Now, I will say this with a caveat. If you go on this medication and you use it as a magic pill, or a magic injection, I should say, and you make no lifestyle changes and you overdose on it and you lose weight too quickly, then yes, if you go off of it, you will very, very likely gain weight back very quickly. However, if you titrate this medication appropriately, if you lose weight slowly, no more than 1 to 2 pounds a week, if you focus on keeping your lean muscle mass and you make lifestyle changes along with this, then when we titrate you back down off of the medication, we see very good retention of that weight loss. A lot of people, however, are staying on this long term and they are going down to what we consider something called a microdose. And this is where we take very, very small amounts of this, not necessarily for weight loss, but more for the metabolic effects. So again, as we talked about earlier, these medications can help with metabolic syndrome, metabolic disorders, insulin sensitivity. Again, with that muscle mass preservation and cardiovascular health that it helps with, it can help with all of that. Also, a lot of the studies are showing that it has cognitive benefits. So a lot of people are actually staying on this in small doses for long term in order to maintain some of that and continue, I guess I would say, like biohacking their health and optimizing their body as a whole. But this is one of the most important things that I talk about with my patients is that if you do not titrate up slowly, and if when you are done with your weight loss journey, you abruptly stop this drug, your appetite will come surging back and you likely will gain weight very quickly. But again, it's not because if you go off of it, that'll happen. It's because you have not made the lifestyle changes with it. So these myths can happen with these drugs, but it's important to understand why it's happening so that you can avoid it. All right, myth number 3 is that everyone gets terrible side effects, and this is why a lot of people don't want to go on this. Again, so untrue. And I can say that with confidence because we do not see side effects at our practice. The reason why people may get side effects, the number one reason is that they are on too high of a dose and that they are on too high of a dose too quickly. So many times I see these online programs, or again, people trying to dose themselves because they get their medication online and they think more is better. So they take max dose right off the bat, and you will be sicker than a dog. You will not feel well because that is way too high of a dose to start out on. You need to get yourself used to it, and you need to titrate up on the dose. So what that means is we start very small, and I only increase the dose every 4 weeks so that your body has time to adjust. And why we do this is because with GLPs, they have a half-life of about 2 weeks. However, we do injections once a week. And so when you get to the tail end of that week and you start your next dose, that medication is not fully metabolized out of your system. So you do get a little bit of like a stacking effect with it. And so if you're doing too much too quickly or increasing that dose too fast, you can push yourself too far. And that's when you're going to start to see some of those side effects. Another big reason why we may see side effects is, again, people aren't making the lifestyle changes. So a big thing when you're on semaglutide is you need to significantly increase your protein intake, your fiber intake, and your water intake. And these 3 things, because people can sometimes feel a little bit blah on these because it is decreasing your appetite, they are not keeping track of this and they are not keeping those numbers up, and that can also lead to some of those side effects. So this is why it's very important that if you are a provider prescribing this to your patients, that you have these important conversations, and that if you're a patient, you understand that, as I will say again and again and again in this episode, I'm going to annoy you with it, is that this is not a magic pill. This is not just something that you can take and poof, like all your problems are going to go away and you're going to lose all this weight. You need to make these changes and you need to keep up on these certain things so that you do this correctly and the healthy way to get the best results that you can in a healthy way. All right, myth number 4, which I already touched on this a little bit, but I want to dive a little bit deeper into it, is that higher doses will always work better. And we have actually found almost the exact opposite at our practice. So I'm going to use semaglutide or GLP-1 as an example. So maximum dose of semaglutide is 2.5 milligrams. I have very few patients who have actually gotten to that dose or anything near it. Most of my patients usually average out around 1.5 milligrams. You do not need max dose to lose weight. And actually, the more and more weight you lose, generally the lower and lower dose you need, because now your body composition and your metabolism has changed. And so sometimes doing those higher doses can actually be too much, or again, overdosing and getting you into that region where you're going to have a few more of those side effects. So the goal should never be, oh, we need to get you to max dose. We need to get you to max dose. The goal should be to use the lowest effective dose to maintain weight loss while preserving muscle integrity. And so this is also why it's very important that you are going somewhere that is not just measuring a number on the scale, but is measuring your body composition, which I guess this could be another myth, is that a great example I always give is I had a patient who came in and she gained weight on our InBody. And she's like, oh my God, you see, it's not working. I'm gaining weight. Like no matter what I do, like not even semaglutide is working for me. And I said, hold up, wait a minute here. You need to actually look at your body composition. So when we do that, we look at mainly fat and muscle. Muscle weighs more than fat. And so if you are doing this program appropriately, you should be gaining or maintaining muscle and you should be losing fat. And so when you lose fat, but also gain muscle, your weight may not change and your weight may actually go up a little bit. But what's important to us is the composition and the relation between the two, not the number on the scale itself. So if you're going anywhere on a program, a GLP program, and they are only looking at your total weight, run away. Because right there, that tells me that that provider does not understand the dynamics of how this drug works. And so even if you're tracking that at home, do not chase a number on the scale. You should be looking at fat to muscle, how your clothes are fitting, how your body is looking, and how you are feeling. And so we want to find that lowest dose that is going to prevent side effects and cause you to continue on this journey to have that in-body go the right way. So in-body is one of the most popular things that you can use to monitor this. DEXA scans are also a great way, but not a lot of clinics have those. But I do like a good DEXA scan because it can also tell you your bone density, which again, you're doing this program appropriately and you are maintaining or growing your muscle. You should also see your bone density improve, which is an amazing thing. And myth number 5 is that using a GLP is cheating. And this pisses me off so much when I hear people say this. And I especially hear like gym trainers say this. And like, I literally don't get it. It boggles my mind because I would think that somebody who trains people at a gym would actually use this to their advantage because they have the ultimate best patient for this. They have somebody who is going to the gym, who is doing the resistance training, who is doing the weightlifting, who is hopefully taking your nutrition training you're giving them into account. And they are the perfect person to use this, not to cheat, but as a tool in their toolbox and as like a piece of the puzzle in their journey to weight loss. So I don't know why a lot of people say this. Like, I don't know if they think because they hear all the bad things about it. And I think a lot of it is that so many people go on this, once again, I'm going to annoy you with it, and use it as a magic pill, that yes, then I feel like you are trying to cheat. You're trying to eat Cheetos all day and lay on the couch and not have to go to the gym. But like, oh, I'm going to take this semaglutide and I'm going to lose like 50 pounds. And I'm going to tell you right now, it's not going to happen. And if it does, it's going to be really unhealthy weight loss and you're going to waste away your muscle and your skin's going to get really saggy. So I think that this can be used to a major advantage to people who are doing the right thing to go on a proper weight loss journey. Okay, so I want to quickly use myself as an example for this. I go to the gym about 6 days a week. I weightlift, I do Pilates reformer, so a lot of good resistance there. And then I also do hot yoga. And I have been doing this, I can't even remember for how long. I don't eat like a bodybuilder or anything, but like I watch what I eat and I overall eat very healthy. I watch my protein intake. I could be better with my water intake, but I'm really good with my protein. And I was stuck. For 2 years, I was plateaued. I would fluctuate between 148 and 152 pounds, and the muscle was not moving on the in-body. And I was becoming increasingly frustrated because I was working myself like a dog and I was not seeing the change. At the beginning of April, I started microdosed semaglutide. So I did not do a regular program. I started with a very small dose. And what is it now? Mid-July. So in the past 2.5 months, I have not only maintained, but gained a little bit of muscle finally. And I have lost about 12 to 15 pounds. I still fluctuate here and there depending on the day. And again, I'm not just looking at the number on the scale because just because I lost that weight, if that was all muscle mass, that is not a good thing. So I have lost mostly fat and I have lost a lot of the visceral fat, judging by my in-body scores. And so I feel like this is a great example of you do not have to be super overweight or obese to still use these medications in a safe way. So this is why I don't necessarily think when somebody wants to use this as part of their journey and they do it correctly and safely, this is far from cheating. This is actually being smart and using something to your advantage. If you think that this is cheating, then any medication that we use out there to make ourselves healthier is considered cheating. I guess my biggest thing with this myth is if any of you out there are listening and you have thought about maybe trying this, you're at a rut where you feel like you're doing all the right things and still nothing is changing, I don't want you to feel kind of misled or think that people are going to think you're a cheater. Maybe you've had family members tell you that like, oh, why would you do that? That's such like a cop out. This drug can be wonderful. This drug can really help you. I really encourage you to find a provider that does full functional medicine and can also look at your hormones and look at everything that's going on. so that they can build you a plan that's going to work for you to finally get you to your goals, because there is nothing wrong with wanting to live a long, healthy life. All right, so that's all 5 myths that I have for you guys today. And in kind of closing this all out, I kind of want to go back to the beginning point that I made about how I'm a big believer in correlation does not equal causation. So a lot of the bad rap that these drugs have been getting, people are attributing to the drug itself. Although some of these myths can come true or can happen, it's not the drug itself that's causing it. It is the misuse of the drug itself or not making those lifestyle changes. And I think a really good example of this is the show The Biggest Loser. I don't know if any of you guys know, but I'm like a huge documentary fan. I would rather watch that than a movie. And they recently did a documentary on this show. And what the premise of the actual Biggest Loser is that these people do diet and exercise to lose weight, which is what we've all been told from a young age is the right way to lose weight, correct? But what we saw on this show and what they showed in the documentary was that these people were doing extreme programs. I think they were working out for like 6-7 hours a day, they said. Sometimes they were only eating like 400 or 500 calories a day. And so they were taking something that you're supposed to do correctly and they were taking it to an extreme. And although these people lost a ton of weight and they looked great at the end, because they did not make the lifestyle changes and because they misused the program, most of the contestants gained the weight back, if not more. And so this same logic applies to the GLP-1s. It is not the drug itself that is causing these myths or these side effects or these problems. It is the overuse, the overdosing, or the misuse of these products that is then causing those things to occur. So if we do this the correct way, the safe way, you're seeing a provider who is following this for you and customizing your plan to you specifically, these things can be wonderful and they can really help a lot of people. So I hope that this one helped you guys today. And if you guys have any additional questions on any of this, please reach out to us because we just want everybody to live long and healthy lives. That's all I have for you today. Until next time on the Retreat Radio, I hope that you guys have a great day.
The information shared on this podcast is for educational purposes only. It reflects clinical experience and opinion and is not intended to serve as a diagnosis, treatment plan, or medical advice. As always, please consult with a qualified healthcare provider before making any changes to your health, medications, or treatment plan. If you want to be a part of our community, make sure to follow us on Instagram at theretreat.wellness and theretreat.aesthetics. Thank you so much for spending part of your day with me today, and until next time.